Hello, I'm Dr. Kenneth Ellenbogen from the VCU School of Medicine in Richmond, Virginia, and we're here today at the annual meeting for the Heart Rhythm Society in Denver, Colorado. I have the privilege of interviewing Dr. Chirag Sandasar from the Virginia Cardiovascular Associates in Manassas, Virginia, and he presented a very interesting study in the late-breaking clinical trials looking at the effect of fish oil on the incidence of atrial fibrillation after cabbage. Can you tell us about the results of your study?
Right, so we ventured to see if omega-3 polyunsaturated fatty acids in a randomized placebo-controlled fashion can reduce postoperative atrial fibrillation. Atrial fibrillation is a major health problem. It has a chance to increase the hospital length of stay and increase morbidity and even potentially mortality. We performed the largest randomized placebo-controlled trial to date to do this. What we did is we enrolled patients in this large multi-center trial from sites within the United States of America. And in doing so, we gave patients fish oil at a dose of 2 grams orally twice a day compared to placebo. The fish oil dose was composed of eicosapentaenoic acid and docosahexaenoic acid. Each 1 gram capsule of placebo was corn oil. Patients then went ahead and got randomized to 2 grams orally daily until the day of surgery. Postoperatively, patients continued at 2 grams orally daily until the primary endpoint, which in our procedure case was incidence of postoperative atrial fibrillation after bypass surgery, or patients that had 14 days of therapy. After the surgery was over, patients were followed also up to 1 month postoperatively for endpoint control. We collected data on not only baseline demographic information, such as a patient's age and clinical variables of interest, such as hypertension, diabetes, myocardial infarction, ejection fraction, and left atrial size, but we also looked at medicines in terms of their background usage, beta blockers, statins, and ACE inhibitors. In our study, in the randomization scheme we used, it was 1-to-1. Patients had a similar incidence of all the usage of the aforementioned, and their clinical variables were similar as well. So we went ahead and analyzed the data in both a chi-square test and a student's t-test for both the primary endpoints and the secondary endpoints, which in our particular study included hospital length of stay, postoperative myocardial infarction, postoperative bleeding, and postoperative stroke. We also looked at the recurrence rate of atrial fibrillation postoperatively. In this intention to treat analysis, post-bypass graft surgery atrial fibrillation incidence was similar in both the fish oil group and the placebo group. The p-value was 0.67. Interestingly enough, the secondary endpoints were all pre-specified. They were also shown to have p-values greater than 0.05. Thus, they were not statistically significant.
What was the incidence of atrial fibrillation in these patients?
33% in our fish oil group and 30% in the placebo group, which is very similar to the standard data that we have available to us today in bypass graft surgery patients. No change. We also looked at fatty acid levels in patients post-bypass graft surgery to see if there was actually an increase in plasma concentrations of omega-3 fatty acids compared to placebo. And it turns out in patients receiving omega-3 fatty acids, there was a statistically significant increase in the fatty acid levels, suggesting that the EPA and DHA levels were markedly elevated compared to patients receiving placebo. This was drawn on the day of screening, day of surgery, and postoperative day number 4.
So what fish oil was certainly, we hoped it would be an option. Anything that would be effective for the prevention of AFib would decrease healthcare dollars. Are we pretty much done with this and time to move on to another drug? What do you think?
Well, we performed the largest study to date in a multi-center fashion in the United States. As we can tell so far, there is no advantage of fish oil in reducing atrial fibrillation in the post-bypass graft setting. Unfortunately, there's also no other good drug available, period. We thought we would have a novel opportunity to try something that has very little side effects associated with it, but that was not the case. I do feel that there is really no need to perform any more larger studies. This is the third now orally administered randomized placebo-controlled trial that have shown similar results, that there is no benefit of fish oil in the reduction of postoperative atrial fibrillation.
Thank you very much. I can't tell you how important it is to have large randomized controlled clinical trials that people look at and people know about it, even when the results are negative, because it's important to have that information to guide our therapy, because using drugs that make patients better is important, but also not using drugs that don't help patients is important as well. Thank you very much.
Thank you, Dr. Ellenbogen.
Great.